Alright, so in this video we're going to try to give you a singular focus, or what's sometimes referred to as a North Star, for your insurances. Basically what you want to do is just make sure that your insurances with the highest cost of loss should be those insurances that recommend you the most. So the first thing to consider here is the long-term winning contract matrix. On the vertical axis we have high cost of loss, or we have cost of loss on the vertical axis, high being towards the top, and then we have short-term winners and long-term winners. Basically, your contracts that are long-term winners, these are your contracts that meet your net income targets for the long run, and they're also the ones that, if you were to lose them, would have the largest impact to your bottom line. So that's what this matrix is showing. The next matrix here is the patient nudge matrix. So essentially, how strong do these payers nudge their patients towards you, and do these payers recommend you or not? So you could be a capitated contract where all those patients have to come to you, or you could be out of network and not recommended, and those patients are realistically rarely going to come to you. So that's kind of the spectrum of how that nudge could work. So then when we think about how these matrices should be aligned, your contracts with the highest cost of loss, so top of the contract, long-term winning contract matrix, those should be the contracts that nudge patients towards you. What you want to avoid is having your well-paying contracts push patients away from you. So that's the example of this line. And you want to avoid your low-paying contracts pushing a lot of patients towards you, because that could also hurt your bottom line. So it's a very simple, high-level thought process, but it's just to illustrate the idea of when you engage with your contracts, how should you be thinking of them. If you need help with really anything with your contracts, feel free to reach out, and we'll be happy to help.